So another example, we start with the OptiChem blood analysis, and the pituitary hormones are off. The thyroid hormones are off. It looks like the sodium potassium is off, and it looks like the ratios of the T3. So we might even think that the steroid hormones, estrogens, and stuff like that are off. So we already have from the OptiChem, we have a pretty good analysis of the pituitary. So the pituitary TSH, and there's other pituitary hormones that we could look at. But that messes up all other hormones. So if that's off, we have to look at what is causing that. Now, interestingly, what is causing that most times is the immune system, blood sugar dysregulation, or stress physiology. And that sends messages up to the pituitary that the body's in danger, sends messages up to the brain, and then it sends back messed up signals to the rest of the hormones. But the pituitary organizes stimulates what the thyroid's doing, stimulates what the adrenal is doing. We have the numbers for the thyroid. We may want to look at some more, but we have to ask, is it a primary thyroid? Is it a conversion problem? This stands for thyroid binding globulin. Is it that your thyroid hormone is being inactivated in the conversion process? Is it a problem with the receptors, where your thyroid hormone looks normal, but you have tons of thyroid symptoms? Then it's probably the receptors in your body that are damaged. So all those things can be treated, but all of them are treated differently. So we have to consider all of those possibilities. Is it a stress, or in functional medicine we say that's actually an adrenal hormone problem? Now stress goes far deeper than just being a hormone, but we can change hormones, and then we can look at emotional stressors and things like that. But let's start by treating it as a hormone problem and looking at physiological stressors. Are you anemic? Now, we got that on the OptiChem blood analysis. So if we know your hormones are off and you're anemic, we may fix the anemia before we start digging deeper at the adrenal hormones or the mitochondria. So this is your production of oxygen, or transferring oxygen to the cells, and ATP, which is converting glucose into energy. So the mitochondria and the red blood cells, basically. So if you're not oxygenating and if you're not producing energy, your body is sending signals up that there's a stress going on down here, and your brain is changing your stress hormones. Same thing with blood sugar. If your blood sugar shoots up and your insulin shoots up after it, crashes your blood sugar down, your cortisol has to fire. It has to increase in production so that you don't go into like a hypoglycemic coma. So if your blood sugar is up and down, it causes stress to your adrenal glands. If your immune system is activated, and again that goes back to the other, but we have to consider it if we're looking at hormones. So we would look at that CBC again and go down that other chain if there's an indication for that. But the immune system can dampen or stimulate your adrenal physiology, your adrenal hormones, and any type of inflammations. Inflammation in your body is basically types of hormones. There's lots of names to them, prostaglandins. When you take an aspirin, what you're treating is actually the hormone prostaglandin. So we have to look at what hormone it might be, treat the inflammation, because the inflammation also is signaling to your brain that something's wrong, and that stimulates the stress physiology. And then we might consider sex or steroid hormones. And now I mentioned the reason why we don't put that on the OptiChem panel is, particular with women, is at different times of the month you should have different hormone ratios. So if we really need to dig into the female hormones, we have to do a 28-day cycle. We have to look at what's going on throughout that cycle, and I have another video on that, of what a normal cycle looks like and where the dysfunctions happen. But it may be changed at the beginning, or changed at the end, or messed up all throughout, and it'll lead to different treatments. We also want to consider, in medicine we just look at, are the hormones low, and then we give them. Not we, they. we look at also, are the hormones high? And a lot of times we see high hormones, and um, I think that may be, again, one of those situations like, what do we do in medicine? What do we do with high hormones? We don't have a treatment for that, so we're not going to measure for those kind of things. So that's the algorithm, the process of questions that lead to an answer, and we might go, okay, the adrenal physiology is whacked. That's stressing out the thyroid. That's stressing out the pituitary, and it's all because of an immune process. So we start here, and then we fix here, and then we fix here, and then we fix here. And this is how we diagnose the undiagnosable. So when we go back to the Merck manual, if you want to leave your level of understanding of health at that level, well, you just don't know why anything happens. Everything is etiology unknown. Everything is, it's probably genetic. We really don't understand. And good luck with that. What, where does that bring you? And we know where that brings you. Here, take a drug that suppresses the symptom and take it for the rest of your life. And I hope it works. So everything has a reason. That's a founding principle of our clinic. Everything has a reason. So if you don't know why, if you don't know the reason, you just haven't asked enough questions. And if you just run a CBC, a CMP, and a lipid panel, you'll never understand why. When you discover why, the treatment becomes self-evident. And in my field of medicine, we have protocols and solutions for the things that we find. So it may not be self-evident to you that, oh, my B cells are elevated, and that's wrecking my thyroid gland, and that's wrecking my metabolism, and that's wrecking my life. You might not say, oh, well, here's what I have to do about it, but at least you have the why, the reason why, and a physician such as myself knows how to change those things. So it becomes self-evident what you need to do. You need to bring the B cells down. How you do that is another video. All diseases, conditions, problems have a functional process behind them, and that really is the why. That is the reason. It's the functional process that led to them. That is epigenetics. What were the circumstances that led to the dysfunctions that led to the disease, which is defined more as pathology, meaning pathology is defined as a tissue change. So you can actually put your finger on, hey, there's a tumor, hey, there's a bleed, hey, there's a clot, something to that effect. And one of my favorite big picture concepts, philosophies, is you can't have fleas and lice, and that one of my old professors used that analogy, I think, for ability to recall it, because you don't forget that. You have fleas, and you can have fleas and lice, which means that you can have two reasons for the same symptom. So you have to keep your eyes and your ears open to what all the possibilities might be. So that is the process by which we look at the internal environment of your body, and we'll go through also how we look at the brain processing, and also how we do the physical processing in your body as well. But this is how we answer those questions. This is how we diagnose the undiagnosable, and many times treat the incurable. Thanks.